Area dentistries are having to change up their routines and procedures when it comes to handling patients during this pandemic. KMR Local 4's Jason Bridge spoke with a local oral surgeon about the adjustments they've had to make.
We're putting ourselves at a certain risk by seeing these patients, but we feel that risk is justified because we are keeping these people out of the ER.
Dr. William Graves with Amarillo Oral and Maxillofacial Surgery on how they're ramping up efforts to help area hospitals by being more aggressive with their treatments.
Instead of placing people on antibiotics for a few days and watching it like some people would do in the past, is we're really being more aggressive as far as treating those patients and treating those cases just to make sure that these cases don't develop into something that requires hospitalization.
Which lessens the potential exposure for a patient and allows more time and space for medical staff to focus on handling potential cases of COVID-19.
We want the hospital and the resources of the hospital to be used for sick people and not for people with toothaches.
And to focus more on patients who are in pain that could lead to potential hospital visits, Graves says they've cut out all non-essential dental work like cleanings, whitenings, and other oral procedures. They're also asking a more detailed questionnaire.
Making sure they haven't traveled outside the United States, and even now we're making sure they haven't traveled outside of Texas is some of the questions that we're asking these patients, just to kind of maybe lower the risk of one of our employees possibly contracting this. Everybody we're seeing obviously isn't a COVID-19 patient, and everybody we see we may prevent from getting COVID-19 because they don't end up in an ER.
In Amarillo, Jason Bridge, KMR Local 4 News.
Jason, thank you. Graves also adds that for an extra layer of protection, all of his employees are wearing those N95 masks.